Yeah, that's a great question. That really depends on what the patient is coming in with. It depends on a lot of factors, including the age of the patient or how long the injury was, where in the inflammatory process they are, whether it's acute or chronic. But there are different modalities that we use to treat chronic pain versus acute pain. It also depends on the inflammatory process as well. If there's a lot of inflammation involved, then we'll use modalities that are very anti-inflammatory. If there's a condition where there's a lot of stagnated tissue, and we'll talk about what that is as well, we want to perhaps create a little bit of inflammation, but a positive inflammation to actually get the body involved in the healing process. So there are a couple differences there.
That's so interesting.
Yeah.
Well, so tell me, why do you think that chronic pain is so prevalent?
I think part of that is the way we've been looking at pain for quite some time in the U.S. has been really symptom management and not necessarily, again, looking at the root causes. When I talk to patients, I say, well, when you have a headache and you take Tylenol, what happens to your headache? And a lot of patients will say, well, my headache goes away. And that's sort of true. And what's really happening is that you're taking a pill that blocks your pain patterns, and sometimes that pain cycle is broken. But people who have chronic issues, that pain cycle doesn't go away, and then that pain just comes right back. So you have to keep taking this medication. We're actually seeing that pretty significantly right now in the Western world when it comes to the opiate crisis and epidemic. What researchers are starting to see is that the opiates are actually making your pain receptors stronger. So although it is very short-term helping you for pain, it is actually making the problem worse because it's actually making you more sensitive over time. So it's a way to really keep you on the medication because once the medication is weaning out of your system, your body freaks out more and you need more medication to take that pain away. So it's a terrible cycle, and there are ways we can treat those cycles and wean people off of medication and do all of that while treating their pain patterns.
And do you think that's the reason for the shift that we're seeing right now in traditional medicine for physicians to pull and wean their patients off of these opiates?
Absolutely. I think they call it a crisis for many different reasons, and one of that is the huge dependency piece and the addiction piece. There's actually a difference between addiction and dependency, which has also been not very well delineated in the Western world. Dependency is basically when your body is dependent on a medication, and when you don't get that medication, your body starts to freak out a little bit. You start to have symptoms, whether that's anxiety or shaking or sweaty palms, or your pain gets worse, or irritation, those types of things. Addiction, which is also a huge piece of the opiate crisis, is another piece of the puzzle, and that's kind of the standard of what people talk about when they talk about addictive issues. So yeah, absolutely. I mean, I think the Western world is really starting to understand how prevalent this is, and that we really need to start finding other ways to treat these issues without having to use medication.